All right, good afternoon, everyone. Welcome back from the break. My name is Melanie Lambert, and I'm a Senior Medicare Advocate with the Center for Medicare Advocacy. I'm honored to be here with all of you today and grateful to be attending my first summit as a newer member of the Center's team. It's truly inspiring to be a part of a community so deeply committed to protecting and strengthening Medicare, not just as a program, but as a promise to older adults, people with disabilities, and future generations. Before introducing the next section, I'd like to take a moment to thank 2025 CMA Summit community sponsor, Powers Law. To everyone at Powers, we are grateful for your longtime partnership and support. Up next, we have our Community Voice section. This is a moment to hear directly from a community member that CMA has assisted. In the following video, we will hear from Lisa Strelecky, who is a nurse manager at Connecticut Children's Medical Center, and Christine Huberty, an attorney at the Center for Medicare Advocacy, who's currently presenting at a conference on the opposite coast, so she's not here today with us. Since joining the center, I've been struck by something powerful: the deep sense of shared responsibility that runs through everything we do. It's not just about policy or law, it's about people. It's about making sure that dignity, access, and fairness remain at the heart of our healthcare system, and that work isn't done in isolation. It's fueled by our partners, allies, and most importantly, by the voices of individuals from across the country who experience the realities of Medicare every day. And that's what the Community Voice section of today is about. This segment is a space for honoring lived experience and for reminding ourselves why this work matters so deeply. The center and our partners are here not only to advocate, but to listen, because it's the stories of our community that shape the fight for equity, accountability, and justice in Medicare and in healthcare. So thank you for being a part of this extraordinary community. It's a privilege to stand with all of you. And now I'm very proud to introduce Community Voice, a segment that reminds us who we're here for and what we're fighting to protect.
All right. Well, thank you so much, Lisa, for joining us today and for being willing to share your story and the story of your mom. Before we get started, if you could just tell us a little bit about you and yourself and where you're from.
Okay, sure. Hi, and thank you for asking me to participate in this. So I was born and raised in Connecticut. From a very young age, when my brother was hospitalized, I decided I wanted to be a nurse. And I subsequently went to St. Joseph University in West Hartford, Connecticut. And I started my career in pediatric nursing, and then very quickly realized I wanted to go work in the neonatal, the newborn intensive care world. So I went there like in 1996, so it's been almost 30 years. I'm married to my wonderful husband, Matt. I have two beautiful boys, Andrew and Thomas. And I currently work in a NICU at Connecticut Children's Hospital in Hartford, Connecticut.
Thank you. And so we asked you to share a story today mostly about your mom. And so before we get started with all of the Medicare issues, if you could just tell us a little bit about who she was, and especially before she started having the medical issues that led her to come to us.
Sure. So my mom was a wonderful individual, very family-centered. She was married, had 4 children. All of us are still alive and all live in the area. Unfortunately, my dad died after a heart transplant in 1988. So my mom, being the strong woman that she is, continued on and was very involved with her children and their families. She's Italian. She loved to cook and loved to, have us all over for holidays and events. But then Joan, the case manager she must have told me this right before I left. She told me about you, Christine. She didn't necessarily say your name, but she told me the name of your agency. And she said it would be really helpful, probably for you, to call her and see what kind of support she could offer. And so after the funeral and I sort of recovered a little bit, I decided to call because we were devastated and angry, and I wanted to see what we could do. And so we called. Sorry. And I forget her name. The paralegal was extremely supportive and said, I think this is going to be a case we're going to take. And obviously, my first conversation with you was, yes, we can definitely help you here. And that was like the most positive thing we had had through this whole experience. And you, my family still talks about you. We had never seen you, but we had certainly plenty of conversations about how lucky we were to have found you and to receive the support and direction and acknowledgement that, you know, you guys aren't crazy. This is real. Yeah. And obviously you worked a miracle and very positive things came out of that. And somehow after all of that, the insurance company decided, oh yes, we should definitely pay for this. So, a very stressful situation, but you helped to make it easier for us. And I know I've asked you this multiple times. What if I knew about you sooner? What could have helped us? Because even though I'm well educated and a nurse, and my husband's an insurance guy and well educated, it's really difficult to navigate. You don't know how to navigate this system.
Do you have any advice?
Obviously, for future, we know about you.
Right.